my prediction, I think will shake up health systems in the West is that I think we're going to see an incredibly diverse approach across regulatory parameters on just how fast AI is going to be allowed to accelerate drug discovery and small population cohort clinical trials. And I think we're going to see an entirely new and highly amplified era of medical tourism when countries that have looser regulatory parameters are offering personalized drug development for every single thing that a person can imagine. I think that's going to create a major unexpected shakeup that people aren't going to know how to deal with. So that's my disruptive prediction. What do you think will be the most unsuspected outcome?
I think for the diagnostic part, we are already seeing that. As I was mentioning, this company, Neko Health, at the moment they operate in Sweden and in the UK, and I'm like, I want to get this service. It's not very expensive. It's like $400 per scan. You do it every 6 months, and it gives you fantastic data. And I'm like, that's definitely worth it. So sometimes I'm even thinking, okay, should I just get on the plane and go to London and get that done? I mean, I live in Frankfurt, and then it's an hour flight. And I was listening to a podcast recently, and there was an American lady who went to Turkey and got like all sort of diagnostics as well, like blood analysis, scanner, etc. And she was saying, well, it costs a fraction of what it will have cost in the US. And I think it's not only the cost, because in some countries, if you want to do that, you will need to get a recommendation from your GPs. And there are countries where as long as you pay, you will get the service. So I think to your point, this is already happening, not necessarily at the drug level, but more at the diagnostic level, because we are already starting to see those very innovative, personalized diagnostic things that are available in some countries and not everywhere. And I think, with all the discussion around longevity, on, people who want to monitor, like everyone is wearing a smartwatch and everyone is getting some personalized metrics. So I think there is now people are more conscious that if they have the right data, they can do something about their health, they can impact their health, they can do something before disease happen. So there is definitely this willingness to get access to those services, and I think people are getting frustrated when they can't get it. So now, of course, I mean, imagine you take that to the next step, and you will have different countries, different regulation where you can access different treatment, and of course, people will do more medical tourism than what they do today.